Hello, everyone, and welcome to another episode of the podcast. Here we explore everything that helps dentists build extraordinary careers, not only clinical dentistry, but also communication, personal branding, leadership, business, and the skills that make a real difference in today's world. Today's guest is someone who perfectly combines all of these areas. She's a dentist, practice owner, leader, educator, coach, and one of the most recognizable voices helping dentists grow beyond clinical skills. Dr. Neda Rafati is joining me today, and I'm really excited for this conversation. Hello, Neda.
Hello,
How are
hello,
you?
Chris. I'm doing great. Thank you so much for that wonderful introduction. I loved hearing it. I'm like, wow, that sums up pretty much what I've been doing over the past 16 years really well. Thank you.
Actually, it's those are only facts. So it leads me actually for the first question, which will be a little bit warm up, let's say. So, when people like me, they look into your Instagram, they study your profile, your character, let's say, um, they see many different roles. So you're a dentist, right? You have your own practice. You manage a team. You are
Yes.
educating. You are coaching. You are very active on social media. So my first question is very simple. And the question is why? Why wasn't being an excellent dentist enough for you? What made you decide like to dedicate so much of your time like to help other dentists grow? Tell me.
Yeah. So my journey is really unique in a way that I was an associate dentist for many years, and my growth at the beginning as a new dentist was quite slow until I found a really great mentor who taught me how to use digital photography, how to do comprehensive treatment planning, and how to actually communicate with my patients really well. And once that I got over that learning phase and I managed to communicate with my patients so well to get them to actually understand the value of the treatment, then my practice started growing tremendously. And learning those things allowed me to share it with other dentists that would come across my office, my associates, my clients later on. I was also teaching at the UBC Faculty of Dentistry for a while. So it also allowed me to see both perspective from early career dentists, mid career dentists, more seasoned dentists, and we're all walking the same path. We all have the same challenges. Of course, we're in different clinical skill sets depending on the number of years of experience, but there are certain communication tips and wisdom that I gained after learning from this mentor that I had that allowed me to become aware of the blind spots that I had. And I see that in a lot of other dentists struggling with that confidence, how to actually communicate the value of treatment to your patients. Those are the main key factors that became the reason behind me getting into sharing my ideas with other dentists on social media, connecting with more dentists, and being able to get more fulfillment, not just from you were asking me why dentistry wasn't enough. Like, dentistry is wonderful and I love transforming my patients' lives, but I'm actually able to transform many more patients' lives by teaching and educating other dentists that are walking the same path as I did.
So Who was this enigmatic mentor?
So my mentor as Dr. Florence Lockhart, who's retired now, and what she taught me was the comprehensive way of treatment planning and seeing the mouth, not just one tooth at a time. I'm looking at the big picture and also looking at different people's communication skills and using that, mirroring their communication skills to get them to trust you and go ahead with what you're recommending. And her method was based on Dr. Frank Spear, who's one of the educators here in North America, but I know that he's also very well known throughout the world. And then I started learning more, taking Dr. Spear study clubs, courses, and then gradually I started learning more in depth about treatment planning and how I can help my patients make the best decisions for themselves.
So Neda, do you think that we as dentists, we have difficulties in communication with the patient in general? Because obviously we are not trained during dental school, proper communication skills. I know because I'm a part of the dental school.
Yes.
I know the program, and I know it's something that takes a lot of time, many successful and unsuccessful treatments to become a master in communication skills. So what's your opinion on that?
Yeah, definitely. There is, dental school only has a certain amount of time to teach us so much, right? They got to teach us how to start holding a drill, like from the very basics, how to drill teeth, how to treatment plan, but of course that talking to the patient and the communication aspect, in my opinion, it's a very outdated way of teaching how to provide treatment options to patients. Nowadays, with our patients having access to AI, there is no lack of information. The way we were taught in dental school is our patients coming to us to get more information about treatment options. Well, we all know so well that our patients are coming to us already showing us, oh, this is how Chad did my digital smile design. Like another patient was like, yeah,
Exactly.
look, this is like, I'm like, yeah, there is like no lack of real information about dentistry. They can find out anything we learned. Mind you, they can do dentistry to themselves, but ChatGPT or other AI tools can easily give them all of their treatment options. So how are we as dentists, as clinicians, are going to be different than just providing information? And that's where the missing communication piece comes into play. And with the proper communication, we're able to identify what the patient really wants to hear from us, the words that they don't say. A lot of us, for example, hear from our patients, I'm going to think about it. I'll go home, think about it, and I'll let you know. But that's the way our patients telling us that something is not sitting well with me. I'm not trusting the process. I'm not confident to go ahead and say yes right now to your treatment. Versus if we are so good at not just providing option A, B, C, versus saying, you know what, option A, for example, if you're missing a tooth, a dental implant is your best option, and spending more time creating value for why your patient should go ahead and receive a dental implant as opposed to the alternative to replace the missing tooth. So dental school taught us talk about bridge, no option first, and then bridge and how, and then dental implant. But then by then you've lost your patient. Like our patients have limited attention span, like all of us do these days. So it's important for us as dentists not to just be an AI and just provide options versus create value for what the best option is and empower your patient to make a decision as opposed to saying, hey, I'm going to go home, I'm going to think about it. And then years go by and then they come back. They're like, you know what? I wish that I got ahead with like what you mentioned. Like, why didn't you tell me this is going to happen? For example, if I don't put a crown on the tooth that needed a crown, now I'm losing the tooth. Like, why didn't you tell me I'm going to lose the tooth? So I think just like being very clear with your patient, what will happen if they didn't go ahead with your treatment recommendation? So the consequences of lack of action is something that we all need to get better at as dentists.
So what do you think is the key factor for a good communication with the patient? Because I also do believe that the communication with the patient, this skill particularly, is very unique and different to communication with other people's, for example, your associates, for example, me with my students. What do you think?
Yeah, so you mean how we communicate as dentists to our patients versus how we communicate with our associates?
Exactly, the differences. And also this, one maybe couple of key factors that really make a communication good.
Mm-hmm. I think it all comes down to talking less.
Talking less?
Talking less, yeah, and hearing and listening more. Because again, as dentists, like our patients' mouth are open and we're always like talking,
Exactly.
sometimes just like taking a step back, especially in your consultations, or even if you're communicating with your team as a dentist or um, your students in your case. I think just like listening to what they have to say and doing less talking and more listening, that in itself is really valuable in understanding what you need to focus on more. For example, if you're what I see a lot in dentists is their self-limiting belief that if they don't know everything about a procedure, they're not going to mention it to their patients. This is not how we want to show up as dentists for our patients. Your patient needs to know all like the best option, of course, all their option, the best options, emphasis on the best option, regardless of my ability or lack of ability to perform that treatment. For example, I don't place dental implants in my practice, but I have so many wonderful dentists that I know that do that. So if I'm in a consultation with a patient, just because I am not placing dental implant, I'm still gonna emphasize that as the best option to replace missing teeth. I see this a lot happening with clear aligners, for example, Invisalign. A lot of dentists hold themselves back in giving the Invisalign option to their patients because they're worried, oh, I don't know how difficult this case is going to be to treat. I don't know what kind of attachments, for example, I place, like the little detail minutia, because our mind is very detail oriented as dentists. I feel that is our worst nemesis. Like, you need to have an open mind. Like, there's so many great options to offer to your patients, regardless of you offering it actually in your practice or not. You still need to make sure your patient understands what the best option is.
So definitely you need to be just honest with your patients and treat them with respect and always give them every possible option that are possible in their case, regardless of even the price for the treatment or whether you're able to deliver it, or will you just send the patient to your fellow dentist or associate who will make the case and earn the money. And I agree, I absolutely agree. I also do believe that people, they feel your honesty, and by being honest to them, you're building trust. Because even if
Exactly.
you will send the patient to someone else who might be skilled a little bit better than you in some procedures, then the patient might come to you for something else, or he might, refer someone else to you because you've already built the trust with the patient. That's absolutely
So true.
crucial.
Yeah, that's
So
so true.
what do you think? We've mentioned off the record about the visual aspect of the communication. How do you feel the visual aspect of the communication? What does it mean for you in case of proper communicating skills with the patient?
Oh, it's night and day difference. Like,
Mhm.
since we've always done digital photography because of the spear method of case comprehensive case presentation. So we always have had that part of our workflow for the practice. Every new patient gets full mouth photo series, as well as radiographs. But since we've started incorporating digital scans, we use iTero in our clinic. It's been night and day. It's been amazing. And the first, I would say, shift was, of course, getting your team excited about it and incorporate it, because sometimes there can be some resistance if people have to add that to their workflow. And for years and years, they didn't have that. But now I can say confidently that my team members are very quick at doing the digital scan. And with the new technologies that incorporated in the digital scans, like such as iTero or the Lumina, you can do a full mouth scan in like 3 to 5 minutes maximum. It's really phenomenal. And not only that, but it also, we use that for every patient in our practice once a year receives a digital scan. It's given us the ability to use the time lapse feature, which shows what is changing over time. For the first time in many centuries of dentist practicing, we now have this option to confidently, very accurately demonstrate to our patients the changes that are happening at their gum level, wear and tear, because the digital scan is overlapping year by year, and it will show you exactly where the changes are. Again, which it just blows my mind. And it just has helped me to become more straightforward with communication with patients, because they can see it right there. I'm not making anything up, especially for dentists that are trying to build trust, establish trust with their patients. And I hear it with a lot of newer dentists or dentists that are new at a clinic. Oh, I'm new here. The patients need to trust me. Yes. And what better way for you to establish this trust through your skills and creating this value for them, so they can see on the scan exactly, like, I am concerned because I see your teeth are wearing down with time. I am concerned because look how your recession, only over a span of 4 years, how much worse it got. I have like all these examples that I use even with my coaching clients, because this is a tool that is so valuable in, as you said, creating that trust with our patients and really showing them and creating the value that, look, this is happening. This recession is just going to keep getting worse if we don't change, for example, the way your teeth are aligning, if we don't change the other contributing factors, that now we can be all about prevention, as opposed to before we would be like, oh my God, you have so much recession, let's send you for gum surgery. But now we have better preventative measures to offer to our patients, because we can identify these changes sooner. Sorry, there is a bee around here. I'm like trying to avoid the bee as I'm talking.
Just grab a tool or something.
I know. If only, yeah. Mm-hmm.
So, well, you're more into scanning or photography, or was there a photography first, and then when the scanner was introduced, you shifted into scanning because it's like easier to do and more fancy equipment, and also showing a 3D visualization of something for the patient has this kind of unique perspective. What do you think?
We do both. So before we had the digital scanner, we only like had the photos to show patients in terms of like visually, but now we still do the photos because we want to have, like, especially for the front desk, if they're trying to like quickly go to the patient chart and look at a certain tooth for insurance predetermination purposes and other things, they have access to that quicker. Mind you, the digital scanner also allows you to do the screenshot as well. We're still doing both. We did, before we had the digital scan, we only did the SLR camera. We had that. Now we do both. We do the scan and the photos.
What else is of importance in this whole thing that you also teach during your course?
So I teach the dentist, first off, to start with their own mindset and be aware of their own internal struggles, because we hold ourselves back in providing our patients and talking to our patients about their best option a lot of times because of preconceived notions that we have of a circumstance. It could be the timing of the conversation. It could be us feeling, for example, a lot of us feel bad that our patient doesn't have the money, but then because we're worried about the price tag, not so much, we have to shift our mindset to the value this treatment is going to provide for this patient's well-being and health and longevity, not just what the price tag is, because that's irrelevant in the grand scheme of things of what you're going to be doing for prevention to help them have their teeth for longer. So I think my first principle of the course is the mindset shift. So that's why module 1 of the course, of the Empowered Dentist course, starts with that. And then the second component is the consultation workflow, having a system. And this has helped my recent student actually in the course, was able to, in a span of 4 weeks of taking this course, and each module is meant to be taken 1 week, she's now booked solid 2 weeks in advance. And she said that before that wasn't the case. And she was able to create a system based on what I teach to help her show up in her consults, not all over the place and more systematic. And the other component of the course is team alignment, how to have your team members aligned with your vision and how you want your patients to proceed with treatment. We are a main component of the triangle, I call it, of case acceptance. So we are on the tip of that triangle. There's your treatment coordinator and your hygienist involved in this patient conversations, but we are the main pivot that helps the patient go ahead to say yes. But that doesn't mean our team is not playing a role. Our team is the first interaction with the patient when they call the office, when they walk in through the door, and it's also the last point of exit that patient's leaving. So it is very important to very clearly communicate with your team how you want them to show up, how you want them to talk to your patients about empowering your patients to sign up for the best option, sign up for the treatment that us as dentists have offered. And another component of the course is the digital dentistry, which we're talking about right now, how to utilize digital dentistry to create value for the treatment plan you're offering to your patients. And the last component of the course talks about something that I've struggled with as a mom of 3. And I know a lot of dentists that are parents that are trying to wear different hats and balance dentistry as a stressful profession versus home life, and how to be present when you're at work and how to be present when you're at home, and not, combine the two all the time, which, I call it work-life balance. And that is another component of this program, Empowered Dentist, to create a holistic approach, all different angles of what we need as dentists to move up, grow fast. And that's what has worked for me as a dentist. It's based on 16 years of experience, me as a life coach, as someone who's done many marketing courses. So I've incorporated all of those. And there is also an aspect of social media and marketing in my program as well.
Wow, so it's kind of complex course regarding your mindset, which is great. Also, this other soft skills and finishing with marketing. Kind of very interesting, very interesting.
Yes, I spent a
So,
lot of time making it. I was in my mat leave with my third son, and I'm very proud of it. I call it my fourth baby.
wow,
Yeah.
that's really wonderful. So, um, do you think that within the whole communication process, uh, which obviously is a result of a lot of factors that you've mentioned, our self confidence as a dentist plays a role?
Oh my God, that's like number one. The problem is that a lot of us are confident, but we don't believe that we are. We are confident. A lot of us are confident. Or if you were to ask your assistant, for example, how they see you, they're going to say you are confident. But we ourselves feel like we are not. And that's exactly one of my students was sharing with me the other day.
Yeah,
She has 15 years of experience, and she was like, I feel like I never was a confident person. And I certainly felt that way myself too. I had to work really hard to feel confident, competent, and come across that to my patients as well. um, as a dentist, you don't want to fake it till you make it. Like, that's not how we want to be. We
sure,
really
absolutely.
truly want
It's
to.
not social media, right?
Exactly. We want to truly embody that, right? And why
Yes.
not? Like, we all went to school, we studied hard to get through the program to become a dentist. We all are into developing ourselves in terms of taking courses, continuing education. Like, we're all doing so much, but yet we don't believe in our ability to change our patients' lives. Like, that's what we're doing. When someone comes back to you and says, Dr. Chris, thanks to your work, I can now smile. I can now go on dates. I'm more confident going for job interviews. Like, you have done a life changing procedure for this patient. And it goes way beyond the $6,000 they had to pay you, for example, for the treatment. So, just understanding that dentistry is making an impact on patients' lives. Like, this is the
Totally agree.
yeah, this is like the type of work we're doing. But so the imposter syndrome, how to deal with that, this is how we deal with that. We think of all the hard work that we've done, all the hours of sleepless nights, all the stress we've had going through dental school, going through building a practice, showing up as our best version for our team, for our patients. You are already very capable as a dentist. You have everything you need to create that life-changing transformation on your patients. You just have to start having those conversations. I think number one is just start having the conversation. And don't be worried if your patient is going to think you're after money. No, because if you're showing up from the place of like, hey, I'm really concerned about this getting worse for you in the future, they can feel it. They can feel that you are really telling them what's best for their teeth, right? And it shouldn't matter if they say yes or no. Even if they said no, it could mean not yet. A no doesn't mean a no forever. You've done your job as a clinician, as a dentist, creating so much value for what the best option is. I can't emphasize this enough. Like, spend more time creating value for the best option, and then the rest, you leave it in your patient's hand. And sure enough, when they see that you're detached from them, going ahead with the treatment, that's when they're going to like, you know what, this is right. I'm going to do it. And even if they didn't do it, next year when they come back to you, like, you know what, I know last year you talked to me about aligning my teeth, for example. I'm ready to do it now. Let's get started.
Yes, exactly. I have very similar experiences. Actually, when I have a consultation, and I've had quite a lot of consultations during the year. So I know that the successful consultation is not always the agree of the patient for the plan for the treatment that I've suggested the best possible option straight on, but sometimes is because of the patient financial issues. They know they would like to have this treatment done, but at the moment they are not ready. But at the end of the consultation, they promise that as soon as they are ready with their finances, they will come back and we will do the whole treatment. I believe that this is a very successful consultation because I've built the trust during the consultation, and then even though I'm not having the patient, I won't earn money in a few weeks or even months or maybe a year, but still I do feel that he or she will come back sooner or later, or maybe she will bring back some other people who will like to know what I have to say. So Neda, do you think that the building of the trust is just by a proper consultation? Because I think that it's also a proper social media, because there are groups of patients who are referred to us as dentists by other patients who had some successful treatment done by ourselves in the past, and the other group of patients, for example, they've seen our social media, our befores and afters, what we do, and they made the decision to come. So those are two different groups, and probably also the trust that we've built is a little bit different here and there. So how do you build trust through social media? Because I do believe that you are good at it.
Thank you. You know what? I love it when I get someone in my schedule and says they found me from social media, because I know they already know the type of work that I'm doing. So there's less of like, oh, let me show you my before and afters. Like they've already seen, and second, they already have like the treatment is like already done in their mind, right? So it's like they wouldn't be coming to you if they were still like gonna go. Maybe they're shopping around, but to me, it's like they're going to go ahead with the treatment because they've already, a lot of people that find you on social media, they've looked at other dentists on their social media as well, and they've made the choice that they want to go with you. So whenever I get a patient from social media, I know that it's easy. They're gonna go ahead because they've already have that trust, because they're like, oh, I like the work that you do, and so it makes it easy. And I feel as dentists, just shifting the focus of it's too much work for me to show up on social media. Yes, it is, but it's also your walking advertisement. Like, how many of our patients are sitting in the chair? Even when they're in the chair, they're on their social media. You can easily create a name for yourself, a brand for yourself, by just showing up online. I see you scrolling through my social media, so I can kind of see the transition from the posting and how I've, once I started focusing more on my coaching, it became more like coaching videos and some dentistry, the before and afters of like some of my team, the kids. So this is, kind of like evolution of my social media. And I had to learn it myself. I had a coach that helped me with encouraging me to show up more online. I do my content myself, like I created myself, and that of course takes time. But over the last few weeks, I'm also trying to show up more consistently, and I'm noticing the demand, like what dentists wanna see, and where the focus goes. Like, a lot of dentists like to see the videos of me explaining how I talk to my patients, which is really key for us creating that trust that we were talking about with our patients. And a lot of times, me explaining my preps surprisingly seems to be quite in demand, and I love making those. And it doesn't. I like talking about it because I am very passionate about biomimetic dentistry. I do a lot of onlays in my practice, and that's something again that we were not taught in dental school. There's just not enough time. I know as a specialist, get extra training with it, but for most general dentists, they're not confident doing onlay preps and 3/4 crowns, for example, things that are adding strength to the teeth without reducing a lot of tooth structure.
By looking into your Instagram, I have this feeling that you are so confident in front of the camera. And I know it's a huge part of building our personal brand.
Yes.
So, how can we, what kind of advice can you give us dentists to be more confident and start their Instagram profiles and do what you do, stand in front of the camera and tell something about their passion?
Yes, I get that. It can be really intimidating, and we have to let go of perfectionism. A lot of us have that. A lot of us want it to be perfect. Like, it's not a margin of a crown. It doesn't have to be perfect.
Yes.
You have to show up. You have to show up. You share, and
Yeah, totally agree.
make a mistake, but the same way, like, we weren't confident the first time we were taught how to do a crown preparation. How scary was it? We didn't like, it was scary, but we did so many and then we got good at it. So you have to start somewhere. And the good news is, if they don't want to do like show up to the face the camera and talk, they can also do voiceover. They can use some of their practice images or them just like working with the patient and then have a voiceover, so they're not directly speaking to the camera until they become a bit less timid and less perfectionist, and then they can have like open conversation. And to me, the shift that I made that was key in terms of me getting more views and also getting more recognized as a brand on social media was, I treated that not like, oh, I'm giving a speech, I'm not impressing someone, I'm just talking to a friend. So like, I go to that mindset before I'm recording videos, especially the more recent ones. How would I show up? How would I talk to a friend? I wouldn't use a chat GPT script if I'm talking to a friend. I would just, I would still have the pauses. I would still look to the corner. Like, that's okay. Doesn't have to be really well scripted. You can use different words. Sure, like, you know, um, most of us, English is not our first language, and that is okay. Like, we can use, pauses, and if be like, oh, what's the word for it? Like, that's okay to be more candid and just show up for the reps. And people that do that, that's really sets them apart. You know how many of my staff, I've run a big team of 25, and I don't know about where you are at, but here, all of dentists, a lot of dentists here struggle with finding the right team member, finding the right receptionist, finding the right assistant. Our social media has been like, my social media, I have one of my best associate that has ever worked for a clinic. She found me on social media and she was like, I really like the work that you're doing. I'm looking for this type of mentorship, a practice that does the type of work that you do. And then, yeah, and she's been now working for us for a couple years. So how hard would it have been for me to have to find her if it wasn't because of the social media? And yet it was just easy. She walked in through the door. She's like, yeah, I've seen you. I already know the work that you do. Like, and yeah, it was just great. And I'm like, even if I get zero patient from social media, but I can find good staff, it's still worth it to show up on social media.
I mean, 43,000 followers.
Yeah.
Quite a lot.
Yeah.
What a journey, right? So you
Yes.
started Instagram like 6 years ago, 7 years ago.
I started my professional account. I want to say, yeah, it must have been 7 years ago now. Before
Around
my
7 years.
son was born. Yeah, and he's 6 years old. Yeah, so it's been, and I haven't always been consistent on it. I am now making the point of being more consistent because I'm also develop my coaching program and my course, and I'm trying to create more awareness for that as well on my social media. So that's another reason why I'm showing up more consistently now.
Basically, your target audience is also patients and fellow dentists as well,
Yes.
because you have your own product, and this
Yeah.
is what I also can feel studying your Instagram. Uh, how about ideas for the post? Do they came naturally to your mind,
Uh,
or
that's always a
what?
challenge, I have to say. I'm like, what do I post about today?
Exactly.
Yeah, I go by what I notice the interest is. For example, I was mentioning to you in a recent post that I made about my online prep.
Mhm.
It took off. It got a lot of views, a lot of follows I got from that. Of course, from dentists, which are my audience, um, and it gave me the idea of like, okay, now I can make another video about maybe a different type of prep, or um, how I talk about digital scan, some of my cases. So, and then a lot of my ideas come to me like kind of spur of the moment, or because I have a lot of associate dentists that work for the practice, the patient issues, like the conflicts that happen. And I know a lot of us as dentists have to deal with those. So that's kind of where my inspiration from my posts come from. I also like to talk about balancing motherhood with dentistry and running a business. Yeah, so that's kind of like where my inspiration comes from, and my advice for people who are starting new on Instagram or social media as dentists, and they want to grow, they want to grow their brand. It's not all about how many followers you have. It's about the right type of people being in your social media, and the right type of engagement. If you want to attract the right patient, you have to kind of like be in the mind of that, who is that ideal patient that you're talking to. So, and talk to them, make your posts relevant to them. For example, if you're trying to attract millennial patients, the age range between like 30 to like 45, that kind of age range, then you need to really be aware of what are their struggles, especially when it comes to showing up to their dental appointments. What are their fears holding them back, for example, from going ahead with the dental treatment, and talk to those. A lot of us, I noticed this, we're making the mistake of like just like talking to everybody. Like, not everybody needs to know or is interested really in different types of materials we use in dentistry, right? Or different types of whitening we use in dentistry. But majority of your patients want to know what you as a dentist offer them to make them feel comfortable in the dentist chair so they can actually show up to their appointment. So going one step beyond the mundane of dentistry, saying something like, for example, in my office, we offer sedation, and these are what our different type of sedations are. This is what's going to make you feel like, this is the cost, and then like this is so simple, right? Like a lot of us as dentists, we know this by heart, but our patients don't. And yes, they can find it out on AI, but then you as a dentist, like what does Dr. Chris do specifically? Is like how your mannerism and how you're on camera, that they can kind of build that trust, be like, you know what, I think I'm going to go give them a try. I'm going to go to their office. They feel like they like the vibe of the clinic. Like your clinic is not going to be the best hidden secret. You need to advertise for it on social media. That's how people are going to find out about you.
Yeah, you can be the best skilled professional exist in the world, but if you don't show your work to the world, then maybe no one will know that you are there and you are present to help them and solve their dental problem. So
Exactly.
what you've said is actually marketing, as I believe, and you also know quite a lot about proper marketing. So you know how to distinguish the entertaining content from the marketing itself, and does the marketing happens only on the internet, or is it also a part of consultations that we do with our patient?
Yeah, that's a great point. You're right. Marketing has different layers. Um, and yeah, you are marketing yourself in your operatories every single day. And it doesn't even have to be during your consultation. You're marketing yourself when you're making sure when you're doing a surgery on your patient is comfortable, because guess that's what's going to happen. They go home or they have a coffee with their friends a month down the road, and they are like, wow, Dr. Chris was wonderful. I had zero issues afterwards. The surgery went so smoothly. He made sure I was very comfortable during the surgery. So you're right. That is, again, our patients are our walking advertisement, because that's such a great way of putting it. That is marketing in itself, because we know word of mouth is a great source of new patients for all of us as dentists. Um, but for majority of us, I feel, um, at least in our case, for our clinic, majority of our patients is coming through Google, so through marketing, um, and some through social media, and of course some through word of mouth or friends and family. So it's definitely worth having a well-rounded approach to attracting new patients to your clinic. And that, you're right, that starts with you as a dentist in your chair.
Okay, tell me about the online marketing. Do you think that showing befores and afters has greater impact than showing yourself, talking about the case, and, for example, having a testimonial of your patient, telling something nice about your work? What's the best option here?
Yeah, I think it needs to be like multiple different venues. So for
Yeah.
some people, testimonials could seem scripted or fake, because
Mhm.
you never
Mhm.
know. Like, of course, like all of us have patients that can give genuine testimonials, but for more um, type of patients that are, um, what's the word I'm looking for? Suspicious, or they're like, well, I don't really believe that because it could be your cousin just like singing your praises, right? We want to kind of have like not only patient testimonials, but kind of like a well rounded approach. I think having the patient testimonial video format, especially, it's great. Um, Having some sort of like a behind the scenes of like what you're doing in your office and your thought process, how you're setting up a case when you see um, a patient, like what's going through your mind in terms of helping them with the best option for them, um, and having some before and after is helpful. I feel before and after photos
Mhm.
speaks a thousand words, because it shows your clinical skills, and not only that, but a lot of patients can, or people that are not your patients yet, when they're looking at that poster, like, oh my God, these are my teeth. My teeth look like this. Like they can look like that. Wow. And then they come to you, they're like, oh, like this is like, that's how my teeth are, you know? So I feel having, of course, a combination of both, but having you showing your thought process, the type of person you are online, having a present, as well as having your before and afters, which is your portfolio, online portfolio, I call it. It just, the combination of the two is going to be a great, well rounded way of attracting new patients. And of course, we can't expect it's going to happen overnight. As we were talking earlier, my Instagram has grown over,
Exactly.
5
Years.
years. Yeah. But it can grow fast if you are consistent. I wasn't always consistent. I'm now making the point of being more consistent on my social media, but it is and if you can't do that yourself, delegating to someone on your team who's really good at it, or hiring external help to help grow your brand on social media. And by consistency, I don't mean you don't have to post every single day. Even if you can commit to, like, let's say I'm going to start by posting twice a week, but I will do that every week. And then eventually be like, I can now post 3 times a week. And then building up that way. Of course, it's going to be about a slower growth for your account. But if you can post 4 times a week, that is going to have amazing results on your presence, social media presence.
Well, those are wonderful advices, I think, for our audience. I think the making a first step is the most difficult one in case of social media, building branding and making the decision. All right, let's jump into that river. Because most of us are just dentists, we are
Yes.
not businessmen. We need to learn to also to be entrepreneurs, to be leaders in our practice, to know how to deal with people, to know how to communicate. And also, we would like to take care of our patients, obviously. And then there is our private life as well. And you've mentioned you're a mother of 3 kids, 2
3
kids,
boys. Yes, I
3
have 3
boys.
boys. Yeah.
So tell me, I mean, have you found this work-life balance to be able to have everything under control
If
and
only.
be successful? Be
If
successful.
only. Yes. I feel work-life balance, we throw around that phrase a lot. And it's a wonderful phrase in theory, but in reality,
Yeah.
it is a daily struggle. And some days, at the end of the day, I'm like, wow, I really wish I was less on my phone and more present when I was at home with, around the boys. But I also know that I am catching myself becoming aware of it, which means next time if I'm noticing, oh, I'm on my phone a lot, of course, like for work reason or for office reasons and things like that, I'm like, you know what? This can wait. I'm going to leave till, wait for this until the boys are in bed. And then I can like send that email later tonight or something if it doesn't need my immediate attention. And I think the other thing that I've learned, which was really hard for me to do, and I hear this from a lot of other women that have a business and are moms as well, is asking for help, knowing that it takes a village to raise kids, having the right support at home and at work, having the right team members that you can rely on the times that I'm not able to be in the practice. For example, our clinic is open 7 days a week. And sometimes on Saturday or Sunday, if there is really need for coverage and they ask me, and I'm like, you know what, I really wish I could, but I know weekends are really hard because weekends we don't have our nanny with us. She's off on weekends, so it's just me and my husband. And if I were to be at work and it's him with the 3 kids, and I wouldn't feel good about it. And I'm not going to show up as my best version to my patients if I'm constantly worrying about, oh, what's happening at home? Are the kiddos okay? I should be home. It's a Saturday. They need me there. So I think really um, prioritizing, just constantly reminding myself if I'm at work, staying focused at work, if I'm at home, not thinking too much about work, which is easier said than done. But um, I think becoming aware of it is the first step, because once you become aware of it more, then you will start making the right behavior, right choices in your behavior to help you have a better work-life balance.
I think you're a very successful person. From
Thank
what
you.
I've heard you said, from this conversation and your Instagram profile, is there anything that you regret in your life to this point where you when you are?
Um, Anything that I regret? Yes. I think when it comes
Yeah.
to leadership and dentistry, when I was an associate for about 9 years before I became an owner. When I became an owner, I was offered a position in the same clinic as I was an associate in for multiple years. And
Mhm.
what happened is there was some disagreement from the associates that were already in the practice. And one of them, especially, was really throwing a lot of stone in my way and being very difficult and asking for changes in her contracts and on all of those things. And of course, I feel there was not that I feel, I know there was an element of jealousy there as well, because they felt like it should be them to be the owner of the clinic. But I feel I let it uh, consume me for more than what it should have. Um, I should have, now looking back, really separated with, okay, I had an amazing team of 25 and 1 or 2 people were doing this, but that 1 or 2 people took so much of my energy and attention that I didn't have that attention and energy to give to the other 24 wonderful people that were supportive of me, had my back, were there for me all along the way. So just really separating of, okay, if somebody is deciding to be difficult and disagree with my vision, first of all, I don't have to hold on to them for too long, because that's very toxic for the growth that I was trying to build and the culture I was trying to create in our office. And second of all, it should not consume me the way it did. I think that was the biggest leadership lesson that I learned, that in order for me to show up as an effective leader, I can't let the opinion of 1 or 2 people really consume me and take so much out of my wellness, well-being, I should say.
Wow. So Neda, I can't believe how quickly this conversation has gone.
Yeah.
I feel like we could easily keep talking for another hour.
Can
But you know, all good
I take a
conversation.
picture of?
Yeah, absolutely. Come on. I will also take a picture of you. Here, my glasses will do for
Oh,
me.
sure.
Done?
No, I haven't taken it yet, actually. Okay. Yeah.
Ah. Do it for me.
Yeah. Awesome. Perfect. Yeah. I took one.
You like
Yes.
self?
Thank you. Yeah. Yeah. I took it. Yeah. No, this was great. And I appreciate you reaching out. And it's always interesting when you get messages on Instagram like that. You're not sure. I was like, is this real? Like, is this like, but then I'm like, no, not this.
Really?
Bit.
Come on. You
Yeah.
probably have a lot of, this propositions like that.
Oh yeah, no. But once I actually looked you up, I'm like, no, this is this is real. No, I'm like, yeah. So do you ever lecture in North America at all?
Uh, Hopefully, I will.
Yeah.
At this point, Europe, my local marketplace is where I have lectures. all around Poland at this point. And if there is an
Type
opportunity
of
to go
topic?
somewhere abroad, I go.
Yeah. What type of topics do you usually lecture?
Well, mostly how to utilize dental photography, how to utilize dental photography for various different procedures in our profession, for various different options that we can use photography, because quite a lot of dentists, they do not feel the potential that is inside the camera. They don't know how to use their full potential, and they don't know that they can change. They provide their consultations. They do their business marketing. It's everything is photography.
Yes. Absolutely. So true. It definitely is. Yeah. No, we get everybody trained on our team as soon as they join our team. All of our assistants know how to use an SLR camera for photos. We do photo series.
They should. Absolutely.
Yeah.
Absolutely. It's great. I mean, the scanners are great. And I'm also very fortunate to have one. But I do believe that there is still a place for good photography.
Oh, for
in
sure.
dental office, and it won't get changed in next like 10, 15 years at least.
That's
So
true.
Neda, before we wrap up, I would like to ask you two final questions. Are you ready?
Yes.
All right. So first one. If someone listening to this episode remembers only 3 key takeaways from everything we've discussed today, what would you want them, those 3 things, to be? Ideas?
Yeah, let me give us some thought to be more concise.
Yep. Just think this over.
Mm-hmm.
There is no rush. Come on. Just 3.
So communication can really be a game changer in terms of consult success. And it starts by focusing on the best option when we're talking to patients. That's number 1. Number 2 is using digital scans and digital photography to create more value for your patients when you're presenting treatment options, to help them decide and empower them to decide with the best treatment option. And the third thing I'm going to say, which is going to be most challenging for a lot of us, is showing up online without overthinking it, without being perfectionist. Put your work out there so that you can attract the right team and the right patients to your office.
Unfortunately, I do believe that quite a lot of dentists that I know, and myself including, suffer being perfectionists.
Me
and
included.
that is what holds us back
Yes.
from making progress, really.
Yes.
Yeah.
It can, for sure. But then realizing what you can get in return if you let go of that perfectionism can be very rewarding financially and emotionally. So that could be the way to conquer the perfectionism.
Yes, absolutely. I mean, I also do believe that people who are in their 40s, they, like I am, they are still afraid of doing something, but they do. They do not avoid it. They just jump into, and then they don't care what everyone else thinks or what they comment.
Yes. Yeah.
Which is what I really like about this age, to be honest.
Yes, me too. Yes. Less emphasis on what other people think of us as opposed to what we're doing for ourselves. Yeah, for sure.
You just don't care. You just
Yeah.
don't care anymore. All
Yeah.
right. So let's let you hear last question.
Mhm.
Ready?
Yes.
So imagine a dentist listening to this podcast on the way to work Monday morning.
Mhm.
Those people are passionate, they are ambitious, but sometimes they just feel a little bit overwhelmed with everything they think they need to learn and achieve. So, if you could leave them with just one piece of advice, one sentence that they would remember years from now, what would it be?
Break
Difficult.
break it
That one.
break it down to very, very simple steps, something that you can achieve. Because if it becomes too complex, you're not going to do it and you're going to get just disappointed and not do it at all. For example, if your goal is to be more present on your social media, just take a 30-second video of you walking into the operatory, for example. You don't even have to say anything. And then you can put some educational or content on that video and press post, send. That's the easiest thing. One piece of advice that everybody has that extra 30 seconds that they can do.
Wow, yeah. What I can tell you, that's a really wonderful message, to end today's conversation. Neda, thank you so much for joining me today. Thank you for your honesty, your experience, and for sharing so many valuable insights with our audience. And I'm pretty sure the dentists listening today will leave this conversation feeling inspired, not only to become better clinicians, but also to become better communicators, better leaders, and ultimately build more fulfilling careers.
I certainly hope
It
so.
was,
My goal.
sorry,
That's my
sorry,
goal. I certainly hope so.
really, Neda, it was truly a pleasure having you on the podcast.
Thank you so much. It was a pleasure meeting you as well, Chris.
And thank you to everyone who joined us today. I hope you found this conversation as inspiring and thought provoking as I did. If you enjoyed this episode, don't forget to subscribe so you won't miss the next conversations with inspiring people from the world of dentistry. Thank you for listening, and I will see you in the next episode. Take care and bye for now.